I think that the idea of being able to walk into an organisation wherever you may be, either as a long-term chronic patient or as an emergency, and be able to show somebody and give them that information and get the care that you need and that's right, would just be revolutionary and exciting, because it gives a whole new world to those patients that haven't been able to travel before.
Interesting, very exciting topic. I think it'll prevent a lot of chaos that occurs when people travel without the necessary knowledge and necessary information to get the right health care. If we implement it right, this has huge potential.
We live in a world where there's a lot of interconnectivity and people are moving around a lot. So there's a real opportunity to connect together really important aspects of people's healthcare. So I think as the world's moving forwards into the digital age, something like DECIPHER really has to happen in order to solve the problems of people moving around a lot and having health problems a lot and needing treatment. What would be really useful us as clinicians is that we're always asking our patients, particularly in the earlier stages of treatment, but also later on in treatment, to be monitoring and recording what they're doing, and we send them off to do that. So a project like DECIPHER, which has the ability to allow the patient to put down exactly what they're doing, for that information to be sent back to us, is going to be really, really compatible with the treatment that we do in our clinic.
I thought it's a really good idea. I've been focusing on looking at my retirement and thinking, well, if I want to go and spend 3 months of the year in a different country, this is what I would want to be able to take with me, and it would be useful if I develop a long-term condition that I need treatment for when I'm away. I think it empowers them, because one of the things that I hear is that, well, they don't want to go abroad because they're frightened if something happens. What kind of care will they get? Will people understand them? Can they get the medication? So it restricts their lives, so that actually if this service was available, then they would have much more choice in what they do with their lives. It's a combination of it. The translation is really important because, well, my Spanish would be non-existent. So, for example, I would need something like that to be able to assist me, explain what my condition was, what my medication is, if things don't agree with me, so that they don't prescribe something like that.
I think the translation, being able to translate it to another country, to another language, would be really, really useful. But as I say, any hospital, whether it be in this country or another, to have your notes there in your hand would be vital. And I also do like that assessment of yourself and being able to keep an eye on what's going on and giving yourself more ownership on your own care. I think a lot of patients are ready for that now. And there's a change in the way people are using technology. I think that we're moving towards that.
My job is a lot with medical devices. To give you a simple example, in orthopedics we use lots of different screws and plates, and these screw heads take different screwdrivers. If I don't know which screwdriver to use, I can't take something out. So information of the medical devices will make my life so much easier.